When you type in the search words groin and lesions, the majority of what you find all lead to STDs. I knew that probably wasn't the answer, but at 13, I was too self-conscious and ashamed to tell anyone, not my mother, not doctors. I thought suffering in silence was easier than the embarrassment. When it started appearing in my armpits, I worked up the courage to tell my doctor. For years, it was improperly diagnosed as severe acne until I got an abscess so large that it put me in the hospital. Complication after complication followed. Infection spread throughout my body. Baseball-sized chunks of tissue were removed because it couldn't be saved. 2 things came from this: a permanent ileostomy bag and a diagnosis of hidradenitis suppurativa. It was then that I spiraled into severe depression. The hospital kept sending psychiatrists into my room, but they weren't helping. A social worker finally looked me in the eyes and simply said, "You are allowed to feel everything that you're feeling." After months of people saying everything is going to be okay, don't worry, it'll get easier, it's exactly what I needed to hear. My family is wonderful, especially my mom, but how could they really understand what I was going through? I felt sorry for myself. I felt disgusting. I felt like a burden. How could they understand the emotional trauma I was trying so hard to hide? It was like my life stopped. I was at the dermatologist when she asked me if I was interested in doing an HS focus group. After a short pause, I agreed to give it a try. When I got to the focus group, everyone was sitting around quietly, nervous, knowing we were there to talk about something we keep hidden, something we never speak about. Hesitantly, we started opening up. When I told my story to others for the first time, it felt as though a weight I didn't even realize I was carrying had been lifted off my shoulders. Hopelessness turned to hopefulness. If this is the feeling I got from one simple meeting, how many more people would benefit from simply finding a place to belong? I was so inspired by this one meeting that together with a group of peers formed a nonprofit organization called HS Aware. What began as a resource for Canadians with HS quickly grew to become a global community. I am committed to raising awareness about hidradenitis suppurativa among patients, healthcare professionals, and the public. As part of HS Aware, I help to provide supportive platforms for patients and caregivers to communicate, to know they are not alone, and to belong.